Welcome to the Long-Term Care Chronicles podcast. This is part 2 of our conversation with Dean and Monique from the Dementia Society of Ottawa and Renfrew County. Do your organization offer training to caregivers and maybe to long-term care staff to be able to manage and to be able to cope with supporting someone with dementia?
Wendy, I was wondering if I could jump back to the last question and just add one thing.
Okay.
Well, the supports available for the individual living with dementia in long-term care can be limited. I think there's lots of opportunity to grow. And in terms of what we were chatting before this podcast started to record, is we have many organizations just like ourselves have been putting out music sing-along videos of familiar songs by local artists that they used to attend and see, and art classes that you can do at your what we're calling on demand now.
Yes.
Slow looking activities of paintings from the National Art Gallery. While these activities are a little bit more accessible to someone living in the community, I think there is opportunity to use them in residential care or in a facility. And the one example is recently the Queensway Carleton Hospital, which is a local hospital by us, had mentioned that because of COVID, a number of they've opened up a temporary floor at a hotel for those waiting, for those who are deemed alternative level of care.
Okay.
And they reached out to let us know that our music sing-along videos are the most popular activity of the day, and that they were requesting that we could have more of them, and that it was that one part of the day that sparked some joy in the residents. So I think there is an opportunity there to bring more meaningful activities while maintaining the COVID precautions.
Yes.
I also wanted to mention really just a program that we're just launching off the ground, and what it is it's virtual respite.
Okay.
So we're actually pairing a volunteer with a person living with dementia based on liked activities, and it's an opportunity for the person with dementia and the volunteer to connect, whether that's on a weekly basis or bi-weekly or monthly, over phone, video call, or however, maybe it's a written letter, but to have a conversation. And the idea here is to give caregivers a little bit of a break, because even if you have someone living, even if you're supporting someone in long-term care, it can, the tasks that you have to do to live your life and support someone in long-term care can be overwhelming. So I would love to see a program like virtual respite be more accessible to those living in long-term care.
Yes.
But I think there's lots of opportunity to support people living in long-term care, and a little bit of a collaboration between community programs and long-term care. I think there's the opportunity there.
Go ahead, Monique. You wanted to say something?
Oh, I totally agree on what Dean is saying. And yes, I think we're in a time where we need to be very creative and to look at more, to focus on the person and what is needed, not as much on the system sometimes. And because we tend to narrow down how we see things, but we need to consult with those that are experiencing the changes, and sometimes that's where the ideas come from. And working in collaboration is key. because we're all challenged with different changes at all levels. And here in Ottawa, I think we have good collaborations from many of our community members at all levels, and it's just a matter of finding the resources and ways to meet those needs.
Well, I'm glad that you guys both mentioned about the collaboration, because I think that's where things are going. This pandemic has definitely brought forth the fact that community involvement and long-term care involvement needs to be side by side. It cannot be seen as different silos, where we have one stream for if you're in community and we have another stream if you're in long-term care. So that's great to see and to know that that is happening for the collaboration piece, to be able to offer and to be able to support, because the way that things are now, definitely that's going to be something that will be driven forward. So I guess lastly, what I have here is probably going back to, I guess, the importance of the family caregiver being supported while they have somebody in long-term care. And I know you've mentioned a couple of programs that you do offer. Is there anything else that I guess as your organization that you offer to support family members that do have somebody in long-term care?
Well, we definitely provide ongoing one-on-one contact to all of our family members. We also are linked with other organizations, memory clinics, and so on. So this also helps others to realize the importance of reaching out and to find the support they need. One of the ways I think that we can help the community to be more to learn more about what we do is this collaboration with community members. We were talking earlier about training. How
Yes.
can we help others to understand the importance of understanding dementia and what's needed for the caregivers? And there's this regional and national movement, and it's this dementia-friendly training that we're providing to caregivers and staff. And this helps to understand what is dementia, how to communicate, how to support oneself and family members through this journey, how to best navigate the system also, and to be aware of what's out there in the community. So having more of this concentrated information in the community will not only help support the caregiver through our support groups, but also training, which is for me key and important.
Absolutely.
Go ahead. Dave. Just to echo that, like the dementia-friendly training, I was going to say that it is the perfect training for any caregiver, and it is our goal for any organization or individual business, for everyone to be dementia-friendly trained. And I know that, so we're doing that in Ottawa and Renfrew County. The Alzheimer's Society in your region, wherever you are, would be doing the same thing. So I would encourage you to reach out to receive that training. I'm an occupational therapist by background, by profession. I used to work in acute care before coming to the community and the Dementia Society. And I wish I had this dementia-friendly training. I think that it would have helped equip me to be able to support and engage and communicate with the many people I worked with who are living with dementia. So I would, to echo Monique's point, I think that is, if if we could do one small training to everyone in Canada, I would say it would be this 1 hour training of becoming dementia friendly.
Yeah, absolutely. No, that's, I think, is definitely needed, because it brings up on all the points that were mentioned today in terms of someone being able to recognize what to say. And then, of course, there is, I guess, movements within long-term care in terms of they're changing how they change their approach to care in terms of making it more humanistic, more applicable to the person that they are supporting in long-term care, as opposed to just being it so regimented and task-oriented, right? I mean, yes, they do have that, but as well to be able to have some sort of contact with that particular individual, right?
In the dementia-friendly training, you get into how the environment influences someone with dementia.
Okay.
And that's something that I don't think that many people think about. And so if you're in a long-term care home or any that is very institutionalized, it could be that everything is the same color. And as dementia progresses, our ability to perceive things changes. So we may not be able to tell where the door begins and the hallway begins. And then that maybe that causes some anxiety or a different type of behavior. So we start to teach caregivers and staff about some simple modifications you can make to the environment to help support someone living with dementia to live well. The simple, the very vivid example that we often get talking to caregivers is like that black mat, the black mat that you have at your door, going in and out of your door or at a store. Well, someone living with dementia may not want to cross through that doorway. And after lots of trial and error conversation with us or figuring it out on their own, but they start to realize, well, that black mat can be perceived as a black hole. So no wonder someone doesn't want to go through that doorway. So there's simple things about the environment, and small changes could go a long way, like the lighting or the overhead paging in a long-term care home or in a hospital. Like that could be really confusing and annoying to someone with full brain health or brain capacity. So there's lots of changes that I think there's lots of learnings that can come out of that dementia-friendly training is what I wanted to finish on.
Absolutely. And the next point that I wanted to go and to speak on is with this pandemic and with the lockout that has been experienced by many family members, not being able to go into long-term care, what could that potentially, the behaviors of someone with dementia, not being able to see their loved ones, what that could look like, whether that could be other types of depression, other types of behavior expressive, where the facility may not be able to cope without having to use pharmacological options available to them to be able to have that. What would you indicate and to say for something like that?
Well, I think really what COVID-19 has highlighted is that family members play such an important role in people, every resident that lives in long-term care. Family members are such an integral and important part. And if every family member went on strike, our healthcare system would collapse.
Yeah, absolutely.
But I think what you're getting to is something that I recently read, and it's a great advocacy organization called Dementia Advocacy Canada, is the term confinement syndrome.
That's right.
And so I think due to isolation and being immobile, some residents are experiencing this thing called confinement syndrome, and it really looks like there is a decline in cognitive abilities, and maybe there is some delirium, and that makes total sense when you're in a room not interacting with the people that you typically interacted with. There's dehydration, malnutrition, loneliness, isolation, physical and functional decline, worsening personal expressions of distress or responsive behaviors.
Yeah.
So I think that, I would say that people in long-term care, staff and healthcare providers are trying the best that they can.
Yes.
I think and that's important to recognize. And I think family members are willing and eager to jump in to support. And I think that what COVID has highlighted is that our system is ready for some transformational change.
Yes.
And it's not that people have set this up on purpose. I think this is just highlighting. So I do want to acknowledge the hard work all of the staff members, personal support workers, facility members in long-term care. They're trying the best that they can, and I think that we're at a great opportunity to change. Not a great opportunity. We have an opportunity to change for the better.
Exactly, to not do the same old. And you're right, in terms of the staff that are there, I'm sure the stressors on them and what they're going through is definitely increased significantly with this pandemic. And then, of course, with the loss of not having those family members to come in and to kind of, as you said, they were supporting the healthcare system in a not so overt manner, but it wasn't, known as much as it is, what COVID-19 has pretty much shown that it has.
Yeah, I think that, family members often play a crucial role in feeding residents and helping them fall asleep and calming or supporting someone living with dementia. So, one day they're there, one day they're not there.
That's right.
There's that's a big change. And we know that, as Monique explained what dementia is, this disruption in routine has a significant impact in people living with dementia. Family caregivers are like the glue holding the care team together.
Yes. Mm-hmm. Yeah, definitely. So I guess in closing, we have all of these different pieces, and now we have to kind of put them all together. So going forward, that we'll be able to have, again, that collaboration, not just seeing everything as silos from just community and long-term care, but more of a collaboration between that. How can we use the resources of both to make and support that particular person in long-term care moving forward?
Mm-hmm. Mm-hmm.
Absolutely. And the last training that I wanted to mention, and it helps kind of close this up, is that, some simple infection prevention and control training to caregivers, teaching them how to properly don and doff personal protective equipment or PPE that you're hearing in the news every day. That could be easily done as this pandemic drags on, and I think will drag on. That is some simple training that we could provide, and it could help allow caregivers, family members back into the long-term care home whilst protecting themselves and the residents in long-term care.
Absolutely. And Monique, do you have any final thoughts?
Yeah, well, I think right now, what I would add to this is having a good communication with staff, just to know that their family member is well cared for, and to recognize how hard staff is working and trying their best to provide the care the residents need, but also to have this ongoing communication about strategies that may not have been shared in the past, because the caregiver was present and was able to provide that additional care. So just bits and pieces of information may help a great deal. And not to be so hard on themselves too, caregivers, because they cannot be there. It's out of our control. So it's to find those ways that will make a difference.
Absolutely. Thank you both. I really appreciate your time, both Dean and Monique. Thank you. Thank you so much. I really do appreciate it.
Well,
thank you, Wendy, for having us.
Thank you very much.
You're welcome.
For anyone who wants to connect to the Dementia Society, you can reach out. You can find us on the internet at www.dementiahelp.ca. You could give us a call at any time, 613-523-4004, and find us on Facebook, Instagram, and Twitter.
Thank you for listening to today's show. And if you have any feedback or suggestions for this or any other episode, please contact us on our social media at Twitter at Family Councils and at Facebook, Family Councils Collaborative Alliance. Thank you so much and hope you enjoyed this episode.